sir.
Okay. அனைவருக்கும் வணக்கம். பாலக்காடு தமிழ் சங்கம் சார்பாகவும் கோவை விஜிஎம் மருத்துவமனை கேஸ்ட்ரோ ஆர்த்தோ அண்ட் மல்டி ஸ்பெஷாலிட்டி ஹாஸ்பிடல் சார்பாகவும் உங்கள் அனைவரையும் மனமார்ந்து வணங்குகிறேன்.
டாக்டர்
sir, recording is
1 minute. You please talk in English because Dr.
Sir,
is not very proficient.
I understand, sir. No problem, sir. So, friends, welcome to this wonderful gathering. So, it is nice to have you all on this wonderful Sunday afternoon with two eminent personalities. Let me start with a small joke. I'm sure all of you have seen Hollywood movies. Usually, the president will come to give an address and he'll get kidnapped by terrorists. Today, my president, the chairman of VGM Hospital, has not been kidnapped, but he's in another meeting. So usually the vice president takes over. And so it is my honor today to address you all and give the presidential address. Last week, I read a small joke. எல்லாம் நல்லதா பண்ணுங்க, நல்லா பண்ணலனா கடவுள் ஒரு சின்ன நரம்பு எடுத்துருவாரு. God will pull off a small string in your body and you'll get paralyzed. But sometimes doctors are above gods. And today we have two great gods, neurologists of high reputation. One from Chennai, Dr. Srinivasan, and one from Coimbatore, Dr. Pradeep. There is a saying, two heads are better than one. That is, two brains are better than one. Rendu moola. So, rendu moola doctor. There are two neurologists here today with us. So, I warmly welcome all of you here. And with this, I hand over my talk to Dr. Rajaram sir. Rajaram sir, over to you for the welcome address.
Okay, thank you very much, sir. Dr. Mohan Prasad, Chairman of VGM Hospital and VGM Foundation. Dr. A.V. Srinivasan, prominent neurologist from Chennai. Dr. Medil Pradeep, outstanding neurologist, Palakkad and Chennai. Then my good friend, Dr. N.D. Ramanujan, FRCP. Dr. Suman, president of this event, is a leading orthopedic surgeon. And all people who have joined this memorable occasion, it's a great pleasure for me to introduce the speakers. First of all, let me talk about Dr. A.V. Srinivasan. Avathuvadi Venkatesan Srinivasan. MD, DM, PhD, DSc, FRCP, London, FAAN, FIAN. President, Indian, former President, Indian Academy of Neurology. So practicing neurologist in Chennai. And he has got more than 50 years of service in MMC, Madras Medical College. He is the first Indian to get AINA award in American Academy of Neurology in its annual meeting. He has gone all over the world. He has been rewarded many national, international awards like Best Neuropsychological Award, a very rare award, Neuropsychological Award, Shakespeare Millennium Club Award, former Chairman Board of Research, Tamil Nadu, Dr. MGR Medical University. For information, I would like to tell you that Dr. Srinivasan got his PhD, the first PhD of Dr. MGR Medical University. Very difficult to get PhD in neurology. And Lifetime Achievement Award. Is an inspiring neurologist. He is interested in brain health, epilepsy, movement disorder, headache, cognitive health disease, an exceptional medical practitioner. I would like to underline, stress, an exceptional medical practitioner with humanitarian approach. Doctors need humanism. Though this particular Dr. A.V. Srinivasan is a person who treats patients with humanitarian approach. His authority par excellence in neurosciences. Authority par excellence. Best Neuropsychological Award. He has been rewarded the Best Neuropsychological Award, a very rare award. And he has invented a criterion called ABS-CUV criterion. Published many papers in national and international journals, and he has authored some medical books, attended national international conferences, and he's the former director of Institute of Neurology, Chennai, where Dr. B. Ramamurthy was there as the head, and he was there in the head sometime during the 1920 or 1918. Yeah, that is all out about A.V. Srinivasan, a practicing neurologist, very good in diagnosis, and he is a person who is very much interested in patients' welfare. First of all, patients' welfare. He has written so many books in Tamil and English. So I would say that he is a legend in neurology. We are all happy to have Dr. A.V. Srinivasan to inaugurate this event. When I rang up Dr. Srinivasan just 3 to 4 days back, he readily agreed. He didn't say Pakalam and all that. He immediately agreed. And a nice gentleman to move it. Next, I would like to come to Dr. M. Pradeep, MD and 4 FRCP, MD, DM and 4 FRCPs. Expert in management of strokes. He is a stroke expert. He's a teacher in Postgraduate Institute of Neurology, KG Medical College, KG Hospital, Coimbatore. He is a practicing neurologist in Palakkad, and he practices in Coimbatore also in the KG Hospital. Recently, he has opened a brilliant hospital, New Med Hospital. He is the chairman of the hospital. I went there for the inauguration. All big hospitals came and attended the hospital. I went there for the inauguration. There is some disturbance.
I request the other speakers and dignitaries to keep in mute.
Disturbance is there, please.
Except Rajaram sir, others please keep on mute, please.
Huh? Shall I continue?
Sir, please continue. Now it's clear, sir.
Okay. Dr. Pradeep is very good diagnosis. As I told you earlier, he is an authority on stroke management. This New Med Hospital is a wonderful hospital. I inaugurated just 1 month back. All leading personalities, former collector of Palakkad, Dr. Bala Murali, and some other, and the DMO of Palakkad, Dr. Rita, all those people participated. A very fine arrangement. And I wish the hospital all the very best. And he's a member of World Stroke Organization, member of World Stroke Organization, member European Stroke Organization. He is a member European Stroke Organization, executive committee member Society of Neurosonology, executive committee member Society of Neurosonology, India, rewarded with so many national and international awards. And when you go and see Dr. Pradeep, you find a different person. He approaches patient with a humanitarian outlook, as in the case of Dr. Srinivasan. And I would like to say that he is the student of late Dr. Krishnamurthy Srinivas, who is a very good friend of mine. Whenever he visits Palakkad, he used to come to our house with his family. And I am very proud to say that Dr. Pradeep, student of Dr. Krishnamurthy Srinivas. The first DM, Krishnamurthy Srinivas, obtained the first DM from Madras Medical College. Those two people they are here for the talk show. Dr. Srinivasan to inaugurate and Dr. Pradeep to give a speech, deliver a special speech on stroke. As I told you, he is authority on stroke management. Then Dr. Shuman, who is the president of this event, is a leading orthopedic surgeon attached to VGM Hospital, Coimbatore. He is doing very well. He approaches patients with utmost sincerity, and he has developed so many techniques. And he just gives relief to doctor. When you go and see Suman, and you are sure that you will get your disease cured. And then Dr. Mohan Prasad. Mohan Prasad always smiles. So in Tamil we call Ponnagai Mannan. Always smiles. He never loses temper. Whenever she as a doctor, he has to come across many patients with different tempers. Even if the patient loses temper, he is not losing the temper. He treats patient as a psychiatrist. He is a Tamil poet, and he is a leading medical gastroenterologist in Coimbatore, chairman of the reputed VGM hospital, and also the mentor of this event. I think the particular event was inaugurated by Dr. Sudha Seshayan, former Vice Chancellor of Tamil Nadu Medical University. It is doing very well. Dr. Mohan Prasad is taking all the interest to make this event very successful. It is meant for public and also professionals. I would like to say something about Dr. Ramanujan. Ramanujan got FRCP from Dr. Krishnamurthy Srinivas. He daily attends to his work in BHS, Voluntary Health Services, Chennai. And he is a person, not only he is a neurologist, he is a cardiologist also. Last time he gave an illuminating lecture sometime back, very illuminating lecture, in which Dr. Maykandan also participated. I don't think whether Dr. Maykandan has come, I don't know. I just want to thank Dr. Maykandan. He is a neurologist practicing in Madurai. He is also a pediatrician, and he is the brother of late Avvai Natarajan, prominent Tamil scholar and former Vice Chancellor of Tamil University. And all people, neurologists, doctors, Palakkad, Coimbatore, and Chennai, other places, I would like to thank everybody. I would like to now request Dr. Srinivasan to inaugurate the event. Over to Dr. A.V. Srinivasan. Thank you very much.
Good afternoon to one and all. Indeed, it's my great pleasure and very thankful to VGM Foundation and Palakkad Tamil Cultural Research Center for giving me this opportunity to inaugurate this excellent program meant for people and also prevent the occurrence of stroke, and as well as how to have a good health. I'm very grateful for Dr. Rajaram for giving me this opportunity, and he spoke to me. And he said this inauguration in the Coimbatore place is my birthplace. It gives me immense happiness to inaugurate this particular seminar and also the two talks. And I think it is going to be an excellence explicitly expressed by the experts in neurology who are going to come and then give it, especially Dr. Of course, attended by all doctors. And I'm very particular, very happy to see Dr. Ramanujam, Dr. Pradeep. And thanks, Pradeep. I'm just reminded of the meeting that we all had, and Dr. Suman and Krishnan Arvind, and particularly grateful to the chairmen for VGM. It is my great pleasure that I inaugurate this, and it will be one etching in the mind of each and every one of us till our last breath. Excellence I see in everybody's attitude, aptitude, and brevity in expression, mixing with absolute excellence in thought, word, and action. I'm pleased to do the inauguration. I have used inauguration 3 times, not repeating it, but reinforcing the whole idea of doing this for the sake of the public. I'm indeed very grateful. I'm reminded of one sentence Baba used to say, medicine plus love is Medicare. Medicine without love is medicine. I'm indeed extremely thankful for this opportunity. Thank you very much. I just once again hand over to the organizers. Can I continue my talk?
Sir, you can continue your talk. Please go ahead.
Thank you. Thank you very much.
Yes, sir.
In fact, I chose the topic, how to lead a life without a neurological problem. I am of the very firm opinion that if you know just a gist of how to have an approach to the neurology per se. If you remember 1 to 10, you know neurology. I want this for the public because 1 indicates that there is only one mind for us, and 2 indicates already the right brain and the left brain. 3 indicates there are 3 functions of the brain only. All of them or other things are all coming from this. Number 1, we have a cognition, which is nothing but perception plus thinking. Second, conation, that is movement. And third is affect, the movement disorder, especially the motor expression of our experts thinking. 4 represent the 4 lobes, 5 represent the 5 special senses. 6, there are only 6 hardwares above the foramen, especially foramen magnum, of which the first is the programmer. We call it as a basal ganglia. He programs it and then gives it to the main frame of the computer, and that is called the cerebellum. And this gives it to the keyboard, is cerebral cortex. So basal ganglia, cerebellum, and as well as the cortex form the motor system, which functions on the sensations received from the periphery. And one system nature has given independent of motor and sensory called autonomic system. And the 6th is integrating the motor, sensory, and as well as autonomic system is called limbic system. One below the foramen magnum consists of 7, which is nothing but spinal cord, anterior root, which is giving the signal from the brain to the cord and then to the body. The sensations returning to the spinal cord, forming the sensory root. Both of them, they combine to form, we call it the peripheral nerve, goes and then supplies the muscle with a gap called neuromuscular junction and supply the muscle. Once there are 8 type of speech disturbances and 9 type of other systems examination. And finally, number 10 represents, I call that as the base for the really improvement of our health, and so that we don't get the neurological disorders. This 10 is the etiology of the nervous system, which is present in our fingertips. If you look at your thumb, T represents trauma, toxic, and tumor. Index finger represents the infection, that is namely bacterial, viral, syphilis, etc. The middle finger represents the metabolic and as well as endocrine. Everybody wants to have a diamond ring, so degeneration and demyelination. And little finger is little flow or absent flow, so stroke causes. Hand represent H, hereditary, and ND, nutritional disorders. Now, if you don't want these disorders to come into our system, what is that is expected of us to do first? I will take the 2 different attitude of the functions of the brain, and when we can see how we can really protect the brain by the right hemisphere is a close relationship to the limbic system and emotional expression. Rhythmicity, including chanting, etc. Stimulation of the right temporal parietal junction, out of body experience. The possible risk to the or threat to the brain health, number 1 is some medicines and improper use of them. Second, smoking. This is very, very bad because it causes immediately constriction of the blood vessels, and depending on that, you can get even the myocardial infarction. Excessive use of alcohol can definitely produce all the 6 systems of involvement, which I already told you. The heart diseases and diabetes and other health problems. The diet, which is very poor, and insufficient sleep and the lack of physical activity, all of them are possible risks to the brain health. Medicines and brain health, when you look at it, some medicines and combinations of them can affect the thinking and the way the brain works. Elderly people are more likely than the young people to develop cognitive impairments associated with medication use. Cognition is nothing but perception plus thinking. Psychoactive drugs and antidepressant and anticonvulsants can cause over a period of time dementia, that is a memory disturbance, or it can cause a delirium. In addition, non-psychotic drugs such as histamine, H2 receptor antagonist, corticosteroids used in excess can cause some problem in the brain health. Smoking and the brain health, the chronic cigarette smoking appears to be associated with deficiencies in the executive functions, cognitive flexibility, general intellectual capacity, learning and memory processing, and speed and working memory. Please beware of this smoking. And the benefits of quitting smoking at any age lowers the risk of heart attacks, stroke, lung disease, better blood circulation, and not exposing others to the second-hand stroke. Alcohol effect on brain health, slow and impaired communication of brain cells, even with moderate use. Excessive alcohol consumptions can result in a reduction of body weight, brain weight, and then the regional brain atrophy. The production of toxic ethanol metabolites and their post-transitional modification and the damage to the cellular proteins is one of the proposed mechanisms that contribute to the neuronal damage in alcohol. Long-term changes to balance, memory, and emotions, coordination, and body temperature, all of them are mediated through alcohol. The common conditions that affect the brain health are heart disease, BP, Alzheimer's, stroke, traumatic, and depression and sleep problems. If you look at the age of the people above the age of 60, once again, A, B, C, D, E is a mnemonic. A stands for acidity, alcohol, and Alzheimer's. B stands for blood pressure. C stands for coronary artery disease or cerebrovascular accident or cancer. And D stands for if the children take care of you very well with sweets, you can end up yourself with the diabetes. If they don't take care of you, you get depression. And then the nature itself gives you dementia. And then E stands for either the excessive exercise if it results in the problem in the elderly age group, excessive cholesterol, and epilepsy can cause in the old age. The heart disease and BP, of course, what you should do is control the cholesterol and high blood pressure with a minimal exercise. And I prefer 30 minutes walking. And what we can do is exercises minimally, healthy foods, and once again, reiterating, smoking and alcohol avoid. Diabetes, of course, you have to be very, very careful. The reasons are, if you allow the diabetes, you can land up yourself as an Alzheimer's disease in dementia and with memory problems. It increases the stroke for and the brain heart attack, physical activity, etc. Alzheimer's, of course, can also produce in the elderly people. The brain injury, trauma, which I told you in the beginning itself, adults are at a higher risk of feeling. So how to reduce the risk in the elderly age group is exercise to improve balance and as well as coordination, falling prevention classes for them, make the home safer so that they don't slip and fall, wear safety belts and the helmets, and get enough sleep. I always say sleep is very important for all of us. If you sleep 6 to 7 hours daily, it gives you excellence, and non-rapid eye movement phase literally gives you relief from your physical fatigue, whereas the REM sleep gives you complete relief from the mental fatigue. So one should understand that if the drugs or any activity that disturbs the REM sleep, they can develop definitely what I call it as a mental fatigue, but physically they may be strong. But if otherwise the NREM sleep is affected, then they get physically weak, but the mentally they may be very strong. So the sleep produces usually several diseases are added. If you're going to have an excessive in the night, you have to be very, very careful, because if you're going to have an increased snoring, it can result in obstructive sleep apnea syndrome, which can cause breathing difficulty, in some people epilepsy and altered sensorium. So use them. So if you want to protect your brain health, actions that may help are healthy food, be active, and I always say between 0 to 20, you can abuse, misuse, disuse your mind, brain, and body. But between 20 and 40, do not abuse your mind, brain, and body. Between 40 and 60, please do not misuse your body, brain, and mind. Above 60, do not disuse your body, brain, and mind, so that you are always active and not to get the dementia problem. What do you mean by eat healthily is fruits, vegetables, whole grains, lean meat, fish, poultry, low fat or non-fatty dairy products, less solid fat, sugar, salt, reduced, proper portion of sizes and adequate fluids. All these things are all having a very good effect on the cognitive component, and the nutrients that are necessarily needed for the elderly people are curcumin, flavonoid, saturated fat acid, beta, especially the B vitamins, D, E, and then choline and combination of vitamins. If it is added to the diet, it is very good. Now, ladies and gentlemen, I just gave 15 minutes a talk on this. I'm very fond of giving these mnemonics because it will be remembered very easily. And I strongly believe that if you want to be absolutely free of diseases, what you should do is, one, the attitude should be absolutely positive in your life. Aptitude, that is both physical and mental, also drain towards what you should not do is alcohol and as well as smoking. And some fun for us also is very, very bad. Once you follow these rules, regular exercise, good sleep, and good, what I call it as, you should not really get on angry very much. 65 years, so I'm very fond of including few Tamil words for people to just do that. I always say, உண்ணல் உறிஞ்சல் ஊதல் குடித்தல் பான் பரா கோடுதல் நல்லது அல்ல. இரண்டாவது முக்கியமானது என்னவென்றால், நானும் நீங்களும் வாழ வேண்டும் என்றால் ரொம்ப ஆசையை வைத்தா அவன் ஆசாமி கெட்டிங் இன்டு ப்ராப்ளம். ஆசையை விட்டு விட்டால் அவன் சாமி அளவுக்கு நல்லா ஆகி விடுவான். இந்த அறிவுரையுடன் நான் முடிக்கப் போவது என்னவென்றால், ஆவேசி என்ற என்னுடைய பெயர். நான் ஒரு ஆவேசியின் ஆத்திச்சூடி சொல்லி முடிக்கிறேன். அன்பே சிவம், ஆணவமே அழிவு, இல்லறமே நல்லறம், ஈதலுடன் வாழ்க, உண்பதில் எளிமை, ஊக்கமே உயர்வு, எண்ணியபின் செய்க, ஏக்கத்துடன் வாழாதே, ஐயப்பாடு தவிர, ஒழுக்கமாக வாழ்வீர், ஓடு அல்லது உடற்பயிற்சி செய், ஔடதம் தவிர்ப்பீர், அகுதே அறிவு. Nandri, Dr. K.R. Rajaram, my special thanks to all the foundation people for giving me this opportunity to share some of my thoughts, and it is going to be very good. So to reach the order of excellence, I always say that your attitude and aptitude should be good. The B, the brevity in expression should be excellent. C, the character, and the D is going to be duty, dignity, and discipline. When all combined together with A, B, C, D, you get the E, excellence in your thought, word, and action. Thank you very much once again. Thanks a lot. Over to the mic to the people. And I request now Pradeep. Yeah, ma'am. Is it audible?
Okay, Doctor, and I would to give a lecture on his subject of his interest, that is true. Dr. Pradeep, yeah. Not audible. That's Suman. Suman? Not audible. There is no audibility, Mr. Suman.
Yes, it is audible. Yeah.
Now it is audible, yeah. Dr. Pradeep, you can proceed.
Good evening. Yeah, so good afternoon, and my sincere thanks to the VGM Foundation, Professor Rajaram, for inviting me for this great event. My regards and respects to Professor AVS, my great friend Dr. Ramanjam, who is there, and all the people who have assembled here. And you heard a very illustrious talk from Professor AVS. Yes, actually gone through the whole thing, actually how to live a very healthy, to have a neurological system, how to keep it intact. And my topic is, I'm going to talk on the leading cause of this is how we can prevent the disability due to stroke. And why should we talk about this topic, how to prevent the disability of stroke? Because as we neurologists, we come across this particular disorder day in and day out, and that is the most serious, one of the most serious disorder which we face. It's a big difference between an acute myocardial infarction and acute stroke. The problem being, in an acute myocardial infarction, if you treat this thing, if you open up the vessel, the patient is recovered. No further issues usually happen, unless there is a massive infarction and he goes in for a cardiac failure. But in a stroke, it is not like that. A person with stroke, even after you treat it, you can have permanent disability and morbidity. So he may be the breadwinning person. Usually stroke affects people who are working for the livelihood of the family. And that can cause devastating consequences, because after the stroke, the family will have to look after this person also if he's not fully recovered. So that causes real, what you call, psychological problems in the family also. Because a person with an MI, he's not disabled, whereas a person with acute stroke is disabled. So with this, that is the reason why, under whatever way we can, we should be able to prevent stroke. As we know, because the stroke is a cause of long-term disability. And for WHO, this is one of the priority disorders which they want to address among the non-communicable diseases group to reduce the disability at least by 40% by 2025. That is their aim. So what are the symptoms of stroke? A person suddenly becomes difficulty in speaking, or he get a facial deviation. He can get an arm drift, or he can get weakness of one side of the body, or he becomes unsteady in walking. He can even become unconscious and comatose. All these point to an acute stroke. Once you confirm the diagnosis, you treat the disorder, and with appropriate medications, which I am not going to in detail. But after the treatment, how many people recover fully? Not all. Unless and until they get the treatment on time, within the golden period, they don't recover fully. And not many people reach the neurologist. Not at all. They don't come in the right time. Within 3 to 4.5 hours, they have to reach us. Then only we can cure them of the problem. So ultimately what happens is majority, I'm very sorry to say that, even in Indian statistics, almost 70 to 80% of people doesn't even come, even giving so much awareness, they don't come in time for getting the right treatment, which is called thrombolysis, dissolving the clot if it is an ischemic stroke, or in hemorrhagic stroke, the treatment is in a different line. So that is the main reason for why this morbidity happens, long-term disability happens, because of patients not coming in the right time for acute treatment. What are the risk factors for stroke? Before we go into the stroke prevention, we should know what are the problems, what are the reasons why a person develops stroke. If you ask me, the commonest risk factor is age. Age is the most important risk factor. For every decade past 60, your chances of getting a stroke increases by 10%. That means if you are around 80, you have around 30 to 40% chance of developing an acute. I'm talking of stroke ischemic. Strokes are two varieties. One, there is due to a clotting in the brain, the vessel which is going into the brain that gets blocked, or due to the vessel rupture, which is called hemorrhage. Whereas the majority of the strokes are due to blockage of the blood vessel. 80% of the strokes are due to blockage of the blood vessel, and 20% are due to hemorrhage. So, what are the predisposing factors which lead a person to stroke? As I told, age, if you ask me, age is the commonest risk factor which we cannot prevent. So, that is not a preventable factor. What are the other risk factors? Blood pressure. Hypertension is one of the, I would say, rated as one of the biggest risk factors. Diabetes mellitus, obesity, then smoking. As Professor AVS said, alcohol, dietary factors, that is indulging in overeating, then lack of physical activity, lipid abnormalities. Then there are certain specific diseases called atrial fibrillation and asymptomatic carotid artery. Carotid artery is one of the major blood vessels which goes to the brain. That gets blocked. And many people will not be aware of what is happening unless and until you do a test when you come to us to detect whether there is a blockage. So, with this preamble, I would like to go how to prevent stroke, this most major non-communicable disease which causes lasting morbidity, it causes lasting trauma to the family because the patient has to be taken care of by the family if the recovery is not complete. Now, the cornerstone, I would put hypertension as one of the most important causes of stroke. See, blood pressure is a very silent killer. I don't know how many people go and check the blood pressure regularly. If you want to prevent stroke, check the blood pressure regularly. Or you can have a check the blood pressure at home if you have the BP apparatus. And you have to keep the blood pressure below 140/90. That was previous this thing. Now they say it is 130/80. That will be the ideal blood pressure to keep to prevent the occurrence of stroke. A higher blood pressure gives you a chance to develop a stroke. And also, for controlling the blood pressure, there is various medicines. Once the blood pressure is so, your duty is to regularly check the blood pressure and keep it in the normal limits. Similarly, reduce the salt intake. If you reduce the salt intake, the chances of developing a blood pressure is reduced. Similarly, increase your potassium intake. I will tell you how to increase your potassium intake when I come to the dietary section of prevention of stroke. And similarly, you increase the physical activity with a structured exercise program. Second factor, I would put it as cholesterol. Increased cholesterol is definitely a risk factor for stroke, of which there are good cholesterol as well as the bad cholesterol. The villain is what is called as LDL cholesterol, and the good cholesterol is the HDL. The ratio between the balance between the good and the bad decides whether you will develop a the clotting in the blood vessel going into the brain. Not only into the brain, it can affect almost vessels of the body. So it is your responsibility to eat properly, not overindulge eating. Eat food which contains less of saturated fatty acids. So that is the reason why the blood vessel gets clogged. So there are a lot of ways in which you can reduce the cholesterol. One is by having a good, healthy dietary practice. Good, healthy dietary practice, which contains a lot of fruits and vegetables. That is the first thing. Less of this fatty, dairy products with less of fat, and what you call as a DASH diet. That is the most recommended diet for prevention of hypertension and stroke. The DASH diet is what exactly contains lots of fruits, vegetables, then it incorporates. One thing is fish is also good. It contains a lot of omega-3 fatty acids. Not taking the omega-3 fatty acid capsules, they don't give the same kind of protection as eating a fish. So primarily, avoid red meat, avoid food which contains a lot of saturated fatty acids. And if you stick to the good whole grains, as Professor AVS said, the whole grains is rather than what you call as the refined grains. The whole grains also give you a lot of these protection from stroke, and the cholesterol also comes down. So now, another important factor is alcohol, which is a social problem nowadays, because you don't see the intake of alcohol has increased even in the youth. Right from the younger days, the people have started consuming alcohol, both males as well as females. It's got a lot of problems. High intake of alcohol, definitely more than 4 packs of alcohol a day, definitely has been proven as a definite risk factor for both ischemic stroke as well as hemorrhagic stroke. So, best thing is to go away from, there was previously a theory that consuming less amount of alcohol actually causes more protection and reducing the maybe 1 peg or 2 pegs a day. But that is not convincing. Don't take that as a home message. It is actually what has shown now is that in the long term, that does not give protection. So people were telling, okay, taking 1 or 2 pegs a day gives you a lot of protection. That is not true in the long run. Maybe for a short while, then subsequently that protection also goes away. Physical activity and stroke. There's a clear benefit. If you ask me which gives you a clear benefit for protection from stroke, it is reducing the stroke risk. It is physical activity. And what is the type of physical activity which you want to do? It is neither a very severe physical activity, vigorous activity. It is called as a medium tertile physical activity. It's a medium tertile physical. That is, we look at the physical activity divided into three, the middle portion of that. That is, you can do actually walking, you can do jogging, swimming. All those things are very good for aerobic. Otherwise, it is the aerobic exercises which are good for reducing the cholesterol. It takes care of your blood sugar. It takes care of your blood vessel endothelial function also. So never forget exercises. There are strict guidelines. Actually, what they say is 150 minutes of medium tertile exercise per week is what is recommended. But ideally, if you are able to do it every day, try to do it. So that is going to give you a long-term protection. So obesity is another big problem which is resulting in stroke, high cholesterol. See, this what happens due to the medium tertile physical activity is it takes care of your obesity, it takes care of dyslipidemia, it takes care of diabetes, and most importantly, it causes collateral vessel formation in the body. So that means even if one vessel is blocked, the new vessel starts sprouting and it takes care of the blocked vessel. You'll be surprised to know that it can take care of what we see even in peripheral arterial disease. We ask them to walk, we ask them to exercise, we see new vessels developing and collateralizing. So it doesn't matter even if there is a block. Another important thing which exercise does is it improves the, whatever we are talking in stroke is related to the blood vessel. The blood vessel, inside of the vessel is called endothelium. This endothelium function determines what happens further, whether the plaque develops inside this thing and subsequent thrombus. This endothelial function is preserved in patients who take regular exercise. So this is nothing harm. So it's very simple to do. And I think that will be one of my big advices as far as the exercise is concerned. I spoke about the diet. I spoke about the DASH diet, which includes vegetables, fruits, whole grains, low-fat dairy, low intake of red meat and saturated fat, and less of salt. That should be the dictum in taking the diet is concerned. Then salt intake has to be reduced. Then there is another condition called the homocysteine level, which we have found out. We know that now that is related to this stroke development. This homocysteine is an amino acid which is there in the body. It should not cross a particular level. So as strokeologists, as stroke specialists, we always look at the homocysteine level when a person comes to us with acute stroke. And if the homocysteine level is high, we recommend using a lot of B12 vitamin in the form of fruits. And diet is modified to get a lot of B12. And one of the richest sources of B12 is simple banana. It's one of the richest source, apple, blueberry, all those things can be eaten. So that brings down, rather than medication can be given, but medication has got, rather than the medication, if you can dietary combat this hyperhomocysteinemia, it is very, very useful. Now, another important thing is, as far as the females are concerned, is estrogen and stroke. This has to be addressed. This is a big problem because previously they use oral contraceptive pills. These oral contraceptive pills in females is a definite risk factor because the previous older oral contraceptives had a high level of estrogen content. And this high estrogen is causing vessel clogging. But the latest OCPs contains milder, less than 35 microgram of estrogen. Along with that, the new generation progestin is also added. It's a combination pill which they are using now. But even that has got a tendency to develop stroke. Now the females have also started smoking. So if they smoke and if they also consume alcohol and if they take oral contraceptive pills, the risk of developing a stroke is more than almost 40%. So this has to be addressed in patients with this thing. Now, another thing is, if you look at it, this migraine is a headache disorder. This headache disorder is also associated with stroke. So people with migraine should abstain from taking alcohol, they should abstain from smoking. Otherwise, they have a tendency to develop stroke. Now, I'll talk about a very special disease called, since we are talking about the preventive aspect of stroke, I talk about the carotid narrowing which happens. Carotid artery is an artery which connects the heart to the brain. And there are two carotid arteries which almost take 80% of the, 60% of the blood flow to the brain. There are two vessels in the back which take 40%. So this carotid artery has a special propensity to develop a clot, to develop a plaque, especially where it is called as the bulb of the carotid artery, because of the flow characteristics there. So this is the plaque which gets released and which goes to the brain. So it is very imperative once in a while to check your carotids and find out whether there is a plaque over there. And if it is there, now there are measures to get rid of it. Now, another important disorder which was not addressed previously, which was not recognized previously, but which is very much preventable cause of stroke is called atrial fibrillation. This atrial fibrillation is irregularity in the beating of the upper chamber of the heart. This we will not know unless and until we check it. Most of the time, they are asymptomatic. There will not be any symptoms. These patients will come to you some giddiness or some mild weakness. And when you see that, look at the ECG, you know that the rhythm is irregular. These patients are likely to develop stroke. And this atrial fibrillation, the incidence of atrial fibrillation increases as the age advances. Just like how as I told initially, as your age advances, age is the commonest risk factor for stroke. Why? Because of the lot of such comorbidities coming in like atrial fibrillation, which increases with each decade after 60. So once you recognize atrial fibrillation, there are specific scores by which you go and you identify which person with atrial fibrillation has to be treated and what are the medications to be given. If you give them, they generally don't develop a stroke. So that's one of the very important causes of preventable cause of stroke. So there are so many ways. If you modify your lifestyle, you don't indulge yourself in binge eating. You avoid fatty food. You take care of a healthy diet, and you don't indulge in alcohol excess. If you do your physical exercise properly, regularly, get a good sleep. Very, very important. Good sleep. Check your blood pressure. Keep your blood sugar under control. Because diabetes is a devastating disease. It causes thickening and narrowing of the blood vessel. Very, very important cause of stroke. And you have to regulate your blood pressure, your diabetes, and reduce your sodium intake. Increase your potassium. How do you increase your potassium intake? All these vegetables, all these fruits are rich in potassium. So once your habit of taking a lot of fruits, potassium normally goes up. It brings down the blood pressure also. So with these measures and a regulated physical activity daily, your chance of developing a stroke drastically comes down. So this is what I wanted to tell. This is a disorder, which is one of the most devastating disorders, which causes a lot of not only trauma to the patient, it causes trauma to the family also, because it's a long-term disability. It causes then physiotherapy, exercises, all those things. It's very, very difficult to bring a patient with an acute stroke, shifting from home for a physiotherapy center. Even coming for repeated neurological consultation is also difficult. So if we can reduce the burden of stroke in the community by these measures, we are doing a great job. So with this, I thank Professor V.G. Mohan Prasad and the Museum Foundation and Professor Rajaram, Professor AVS for the nice presentation. And any questions, I am ready to answer. Thank you, sir. Thank you very much.
Thank you, Professor Pradeep, for such a wonderful deliberation. And Professor Dr. Srinivasan, both the gentlemen have given us clues how to lead a healthy life. So how to prevent neurological problems, how to prevent strokes. Now, let us see if there are questions in the chat box. I don't think people have voted, posted questions in the chat box. So what I will do is I will request, Mr. Nalathu Ramanujan, Srikant, and Krishnan Aravind. I think Meghandan Abhay sir is also joined. So Muralidharan, Srikumar, they're all there here along with Professor Rajaram. Can you ask any questions? If you have any doubts, you can just get it clarified. You can unmute. Sir, please unmute yourself, Mr. Nadathu Ramanujan.
Now I'm audible.
Yes, sir. Very well.
One of the preventable, thank you very much for Dr. Pradeep and Dr. AVS for the wonderful lecture. And one of the preventable causes is the drugs like cocaine and marijuana and LSD, and those things are preventable. And if they are, the trafficking is avoided, then it will be better that they don't go in for a stroke. I just want to mention that as a.
Absolutely right, sir. Absolutely right. But in some countries, I don't know. These drugs are being legalized.
Yeah.
To be very frank with you, I had few legalized the sale of these drugs. Advanced, some so-called advanced country, so-called advanced, but I don't think they are advanced actually. But see, I had few patients, and one of the very VIP patients, person's son, came to me with this thing. Young chap. He was in Geneva. And the parents were not knowing. He was in charge of the Southeast Asia, this entire Europe for one company, and he was based in Geneva. And he came with a stroke. Finally, when we were asking the history, after a week or so after admission, this boy came out. I have been taking this thing, one of the hallucinating drugs. It was available there. And they said, how did you get it? We can get it in any shop. So, but unfortunately, then what happened, I tell you, I spoke this to his parents, and they said this is freely available, but they're very big. They're on the royal, family, he shifted his base to Singapore. Singapore is totally,
very
strict. Most strict place. If you have this thing, you will be imprisoned. So he shifted his base to Singapore for the sake of this. So you're absolutely right. Fortunately, in India, there is no, if you have it, you are in trouble. So, but as you said, if trafficking can be avoided, a lot of neurological problems, including seizures, epilepsy, all those things can be prevented. Thank you very much, Dr. Ramanujan.
And another thing is HIV also. HIV.
Dr. Pradeep has given a lecture. Excuse me, Dr. Pradeep has given a wonderful lecture on stroke management. So also the clarification by Dr. N.D. Ramanujan. And I request Dr. Mohan Prasad to have a deliberation about the particular event.
Sir, I'm very grateful. Actually, this Palakkad Tamil Research Foundation, which was founded by Professor Rajaram, has been doing yeoman service, and we are very fortunate that from VGM Foundation we have joined hands with him, and every month we are doing one program in different topics. Once on humor, we did once on RTA, we did once on preventive orthopedics, we did so many on Tamil, on Tamil literature, so many different varied topics we've been doing, and all these are on YouTube, and everything is posted in our website, VGM Foundation website. So you can just visit and see even the backlog stored, events. And today was a real feast to all of us, because today, as we all know, that obesity is really on the rise. It's a pandemic disorder across the globe, and even in India, it's painful to see a lot of obese children. So as obesity comes on, comes along with obesity or all other components of the metabolic syndrome, like rightly pointed out by both the speakers, like hypertension, diabetes, dyslipidemia, sleep apnea, CKD, so many associations can happen apart from our own department disease, the fatty liver disease. So, and reflux also, GERD can be a part of it. So strokes can be a part of this metabolic syndrome. So I think modification of lifestyle, at least 40 minutes a day, brisk aerobic exercises, and whenever possible, at least 2 to 3 days a week, yoga, meditation, pranayama, yogic exercises, and just to calm the mind, tone the body and the muscles will always help. A pliable body with a satisfied and happy mind will take us probably beyond 100 years. I think that is why people in Bhutan live long, and because that is the happiest country in the world, because there's no problems there. So probably we are heading towards it. And what I read from artificial intelligence book is that by 2050, so we'll be living with robots. So robots will be equally playing a role in our lives, and probably we'll have plentiful, because all the solar energy will be transformed into consumable energy, and then we don't need to spend on fossil fuels or things like that. And like it's I mean, the book is amazing book, AI book by Lee. I think any of you haven't read, probably you should read. Very, very interesting, sometimes scary to see how robots can take over the entire world. But what it says is that everyone will have everything. எல்லாருக்கும் எல்லாம் கிடைத்திருந்தால் அதில் இன்பம் என்பதை தவிர துன்பம் இருப்பதற்கு வாய்ப்பில்லை. ஏனென்றால் only when people don't have, they just fight or they're jealous about getting more. Now everybody has everything, then there is no need for even currency. The book says that even currency will go out of vogue. I mean, we are really heading towards a big surprising era soon to come. But until then, we have to really take care of our health. And thank you so much. Over to Professor Rajaram for his comments, and any other comments or questions then before we close.
I would like to thank Professor Dr. Keeda, retired principal. I forgot to thank her, and just thank her for joining the event. And Mohan Prasad is doing a very wonderful job. He's a busy practitioner. In spite of that, when I opened the topic of the particular event, monthly event, and he said immediately, without any hesitation, we'll go ahead. It was inaugurated by Dr. Sudha Sheshayan, former Vice Chancellor of Tamil Nadu Medical University. I think this is the 12th or 13th event. And the lecture by Dr. Srinivasan is exemplary. And he authored so many books in Tamil. He is well versed in Tamil also. And he was, as a director of the Neurological Institute, Chennai, he was doing a very wonderful job. And my friend, my mentor, Dr. Krishnamurthy Srinivas, used to mention him. You please see Dr. Srinivas. He's very good in subject, very knowledgeable. You can take first, second opinion or third opinion from him. He's very nice, and he approaches patient. He will never loses his temper. So I compare Dr. Srinivasan with Dr. Mohan Prasad. Mohan Prasad, the patient goes there and for treatment, he just talk to him as a psychiatrist. So there are only fear complex, even if it is endoscopy or colonoscopy or all that, the patient is in full comfort. That is to say, he never, even if the patient is not in a critical stage, he will not threaten. That is the quality of a good doctor. I am told that Dr. Srinivasan has got that capacity of tackling critical problems, because a neurologist will have tension. So Dr. Pradeep, somebody mentioned in the meeting, that is the hospital inauguration, I went for inauguration, and he said one of the patients rose up and told that after seeing my Dr. Pradeep's face, my disease has gone. It was vanished. So there is a
Thank you, sir.
it's a leading Neurology in Palakkad, 4 FRCPs. You can't imagine 4 FRCPs. I think he's the only man to have 4 FRCPs. There is one person who has got 4 FRCPs. That is Dr. Mohan. He has got 4 FRCPs. That is in diabetology. But in neurology, I don't think anybody has got 4 FRCPs. I would like Dr. Pradeep to do PhD under the guidance of Dr. Srinivasan, who is a research supervisor. He has already put it to 3 or 4 doctorates. So Srinivasan is very good.
Sure. If he gives me a chance, I will.
Today, Dr. Srinivasan and Pradeep, and PhD in neurology is very, very rare. 3 or 4, as far as I am concerned. This event, I am very thankful to Dr. Mohan Prasad again that taking the trouble of coming over there. He told that Dr. Suman will take over my role, and I will come and give the vote of thanks. And if anybody has got some doubt, another 2 minutes. Any doubt?
Yeah.
If they want to speak to Dr. Srinivasan or Pradeep, I will give 2 minutes. After that, we will discuss. Thank you.
No, I'll say 32 sentences. Number 1, height in inches is equal to weight in kg. That's a very simple formula. Height in inches is equal to weight in kg. 10 kg for male, 5 kg for male. Please add. Half of your height should be your waist circumference. If it is more than half of your height, then you are getting into central obesity syndrome, because this is a prelude for you to understand very easily. You don't have to go through all those other multiplication and divisions, etc. Just take the height. Half of your height should be your waist circumference. 2, half the weight in, especially height in inches, is equal to weight in kg. Plus 10 for a male, plus 5 for a female. Please know this, because obesity is going to be the order of the day, as rightly pointed out by the chairman also. I think obesity is going to be the rule today, especially in India, and that can take you to any form of disease.
Fine, wonderful.
Sir, I would like to, place on record the humility that I found with Professor A.V. Srinivasan. First time we interacted over phone, he was so sweet and so nice. I mean, how people can be on top of Everest and still be so humble. The other so humble person is Dr. Pradeep, whom I've known for almost 35 years or so, or maybe 30 years. And, such a great human being, a great specialist, a great philanthropist, a great humanitarian. So today, 2 such lovely humanitarians have today spoken to us. I'm very grateful to Professor Rajaram for bringing them on this platform. I'm sure everybody would be benefited, and then this will be posted again to everyone. So because this is sort of an odd time for us, 2 to 3, usually we used to do between 10 and 11 on Sundays. So last Sunday of every month. So this time we have taken 2 to 3 just to accommodate Professor Pradeep's, presence here, because he was busy in the morning. So thank you so much once again. So I'll just call it a day. Thanks to both the stalwarts and everyone who has joined us. So we'll meet again next month on yet another interesting topic. So signing out is Dr. V.G. Mohan Prasad on behalf of VGM Foundation and on behalf of Palakkad Tamil Research Mayam. Gratitude to Professor Rajaram. Thank you, sir. Bye.
Thank you. Thank you for all. Thank you.